These graduates are from 2019, 2020, and 2021. Ladies and gentlemen, please stand as we receive our Prime Minister, Minister of Health, and other dignitaries. Our Prime Minister, the Honorable Philip Davis. Thank you. Please remain standing for our national anthem. Dr. Glenn Beneby is one of the persons who was initially involved in the establishment of the medical school here in the Bahamas. He's a former medical chief of staff, former chief medical officer, and many other things. But at this time, he's coming to bring the invocation. Dr. Beneby.
Once again, we have this privilege to pause in prayer. Heavenly Father, we come this afternoon on a very auspicious occasion, on an occasion where we express love and we show and celebrate for the accomplishments and achievements that have been made. Lord, when we started this program in 1996, you were there, and you are faithful. You are here tonight. You've been to us through many toils, many difficulties, We came up the rough side of the mountain, but we are very pleased that you have brought us safely to this point, that we can celebrate 39 graduates, of whom we are very proud of what they have done. We have citations in our midst for their outstanding work, their research and accomplishment. Lord, we thank you. We have gratitudes in our hearts as a grateful nation and a grateful people. We thank you for what you have done for us, for these students. We thank you for what you have done for the school. We thank you for the lecturers. We thank you for all those who work in the administration. We thank you that you have brought us to this point that we can celebrate the graduates. And also we thank you especially for their family and friends who have come here tonight to celebrate with them. Lord, you have taught us in your word to admonish our leaders and to praise them and to pray for them. And so we pray a special prayer now for our beloved Prime Minister, our Minister of Health, and the entire cabinet, that you will bless them, help them to see and achieve success as we travel this road together. Give us as civil society and citizens a sense of duty to do what we can to support those who govern us. Lord, and as we come to this point of graduation, we want that our education and training will give those graduates the boldness and the courage to do what is right, the serenity and the humility to accept what they must accept, but most of all, the wisdom to know the difference. And so in the words of St. Paul, I now leave you with these words. Now abide faith, hope, and charity. The greatest of these is charity. Let there be love in this place, and let us go forward as a country with love. We ask this in Jesus' name. Amen.
Thank you, Dr. Beneby. You may be seated. I suppose by this time you have figured out that I am Dr. James Johnson, and I am your Master of Ceremony for this afternoon's proceedings. The School of Clinical Medicine and Research, Bahamas, before it was actually started, and two of the people who were heavily involved in getting the program expanded here to the Bahamas are Dr. Beneby and Dr. Roberts. Fortunately, they are still here with us today. The initial starting up of the school was a little bit difficult, but we are now in full flight. And I'm happy to say we have full established postgraduate programs in most specialties, and that makes a big difference to the level of care that you deliver to your citizens. Honorable Prime Minister, almost said Dr. Philip Davis. Honorable Philip Davis, Honorable Minister of Health, Dr. Michael Darville, got that one right, Dr. Robin Roberts, other hospital administration officials who may be here, other lecturers of the UWI program, our graduates. And as I look at our graduates, I begin to feel my age. I think I can remember when the majority of them were medical students, and a significant number of them will tell you that they may have had one or two little pep talks from me. Because in my early days, I guess I was considered to be the person who would tell students, male students, what their hair supposed to look like, female students how they're supposed to dress, and all kinds of stuff. But I've noticed I've stopped doing that, and somebody has told me that age will do these things to you. But I'm really indeed happy to be able to participate in a ceremony like this where we are recognizing persons who have achieved the highest levels in their specialties and are able to provide that kind of care for our citizens. It is also important that these graduates did not achieve these goals all on their own. their family members, their spouses, husbands or wives, in some cases, fathers, mothers, brothers, sisters, and other relatives who assisted them. Because even though they would have received a salary, or some of them will call it a stipend, while they were training, it does take some measure of sacrifice. So let me take this opportunity to welcome all of you here, and I trust that we will have a very enjoyable evening. At this time, I'm going to ask you to receive Dr. Robin Roberts, who is the director of the program, and he's going to come with an overview of the postgraduate program in the Bahamas. Give him a round of applause as he comes, please.
Honorable Prime Minister and the Honorable Minister of Health and Wellness, my physician colleagues and invited guests. This evening, I begin with a reference to our medical archives of continuing medical education and advancing quality medical care. And I have 4 short quotes. Number 1, medical education at the PMH will become ultimately the responsibility of the local branch of the Faculty of Medicine of the University of the West Indies. Number 2, the faculty representative of each department or division will be responsible for designing the CME format, formal lectures, and clinical teaching rounds. Number 3, the student staff will be comprised of final year medical students, interns, and candidates for the diploma and rotating residency programs. And finally, there will be affiliation with postgraduate training programs in other international medical institutions. I quote verbatim. We wrote this in 1991, 30 years ago. This was the vision of our strategic plan we crafted to guide the new CME office at the Princess Margaret Hospital. I was appointed as its first director, and I then wanted to say whether I was his right hand or he is my right hand, the then medical chief of staff, Dr. Glenn Bennaby. And so tonight, it gives us great joy to see this come to fruition. We have advanced beyond our wildest dreams from our humble beginnings in 1997, when we had only 3 Bahamian undergraduates who joined the first group that came to Nassau. There were several floundering years. One year, we only had 8 graduates. Tonight, we have emerged with a total of 572 medical graduates since we started, of which 90% are Bahamian nationals. We advanced 7 postgraduate disciplines. In 2002, family medicine. 2004, internal medicine. 2004, obstetrics and gynecology. In 2007, both pediatrics and general surgery. And in 2009, we had psychiatry and emergency medicine. Since then, we have produced 127 specialists. We are averaging some 80 postgraduate students enrolled every year in our program now. In a country stricken with non-communicable diseases such that our greatest needs are our family medical specialists, we have produced some 57 family medicine physicians. It accounts for 45% of our graduates. We are right on target for global aspirations for primary care. And if we consider all the primary care specialties, obstetrics and gynecology, internal medicine, pediatrics, it amounts to us supplying qualitatively some 81% of our healthcare physician resource needs that will be allocated towards primary care. We generated opportunities for fellowships. We made it possible for our DM graduates to subspecialize in India, South America, Canada, and the USA in surgical oncology, general surgery, nephrology, kidney transplant surgery, bariatric surgery, laparoscopic surgery. We initiated formal fellowships in infectious disease and gynae-oncology programs in partnership with universities in the USA and Canada. We are proud of our subspecialists, all 10 of them. The government's investment in our postgraduate training programs, I'm very proud to say, has paid us great dividends. Traditionally, on an annual basis, we have few DM graduates, and we recognize them at the oath-swearing ceremony for the undergraduate students. But over the pandemic, sticking to the policies of social distancing, we confined that ceremony solely to the undergraduates. I want to commend our postgraduate coordinator, Dr. Francis Williams, who advocated for the special recognition, and we thank our Prime Minister and our Minister of Health for accepting our invitation to be here tonight. It makes this a very special occasion and truly endorses the government's support since our humble beginnings in 1997. I applaud our 39 graduates who have weathered the pandemic storms. Please stand and salute your teachers, your mentors, your families and friends who have supported you on this 10 to 15-year journey to become medical specialists. I also want to give a special tribute to the pioneering retirees of the postgraduate program who are not here tonight. And I always get in trouble because you mention some people's names that you shouldn't mention and some that you forgot. But I really want to say that in family medicine, we have Dr. Hannah Mahays and Patrick Whitfield, who really started the DM program. In internal medicine, we had Dr. Adrian Sawyer and Dr. Perry Gomez. In obstetrics and gynecology, we had Dr. Johnson, Dr. Butler, and Dr. Minnis. In pediatrics, God bless his soul, Dr. Patrick Roberts and Dr. McNeil and Dr. McDigan. And in psychiatry, we had Dr. Nelson Clark. And in emergency medicine, we had Dr. Carolyn Burnett. And then in surgery, I had myself and Dr. Hepburn, and also a long champion, of course, was Dr. Monroe. So I say that the future of our school's DM program is bright. We can realize the vision that within the next 5 years, we can have a postgraduate DM physician assigned in every government public clinic throughout the archipelago, from Grand Bahama in the north to Inagua in the south. Moreover, we can have a resident assigned to every clinic as well. And with the birth of telemedicine, no resident will ever be left alone. The time has indeed come to have our family medicine residents trained solely out in the field. The vision fits into the National Health Insurance Primary Care Transformation Initiative of a single governance for all the government's 3 primary care services in the PHA, Public Health, and Grand Bahama. This will bring funding, I hope, and sustainability to our family medicine and other primary care specialties for their ambulatory care experiences. And with it, hopefully, we gain the successes that have been shown by the Department of Pediatrics, in which primary care and ambulatory medicine dropped our pediatric hospitalization occupancies to 50% rates and less, and they have remained so. As we stabilize our undergraduate admissions to about 30 students per year, we envisage the realization that every graduate will be enrolled in a postgraduate training program, and to include careers in public health and postgraduate degrees in health management and leadership, not only just careers based in clinical medicine. With every graduate of our MBBS program enrolling in a postgraduate program as those in the final year of the DM graduate, we maintain that balance of our physician supply and remove the scourge of becoming an unemployed physician and without a private practice license. I hope this will be something of the past. I look forward in my lifetime to a full 5-year undergraduate program in the Bahamas as an independent, self-governing faculty becoming a reality. All our healthcare institutions must become teaching facilities, including Doctors Hospital and the flagship institution, the PMH, to be recognized as the University Teaching Hospital of the Bahamas. I would be remiss not to recognize, since my graduation, the many changes that have occurred to the patient-doctor relationship and the role of the doctor some 42 years ago since I graduated. We have the Google survey patient who demands to be involved in their care and make their own decisions. We practice within the context of the business of medicine in a profit-driven environment. Many have limited access to affordable health care. The need for NHI to guarantee a basic standard of care for all remains long overdue. The country's birth rates have dropped nearing 40%, but our population is aging rapidly, and so too the increasing cost of care. We must stem the tide of our country's profile as world leaders in obesity, hypertension, diabetes, cancers, and violence. My generation, we did our job to better tertiary care and public health services and quantifying our physician resource needs. You are challenged not only to continue this, but to do so with a shift from quantity to quality and demanding sustainability, accountability, and value-driven services. In my opinion, these are the foremost challenges to the next generation of physicians. We have mentored you to expect you to do better and to demand better. But you also have the challenge of your personal development. The dictum that medicine is a jealous lover has given way to a need for a balanced life, for family time, and me time. The medicine jealousy has caused more than 50% of our doctors in almost every specialty to be burnt out and morally injured, physically and mentally exhausted, feeling we have minimal or no impact on the system, and losing our calling to care. Long years of training have resulted in high educational loans, colleagues not having a job, and the real fears of not being able to own a home and educate your children after 10 to 15 years of high school. This is compounded by the issues of building a practice and keeping up with your CMEs. And COVID has magnified these challenges. So you have to craft a new vision, one in which all postgraduate programs are available locally where feasible and appropriate. And this must be incentivized by the government for those specialties in greatest needs. You must negotiate for fair and just compensation. We have submitted for 3 additional programs to be accredited to start in the next academic year, namely radiology, anesthesia, and orthopedics. It behooves the government to recognize the economic and social values of local postgraduate programs. They provide the hospital with a cadre of young, committed physicians who are driven to provide the better care rooted in continuous teaching and learning. It stabilizes families, it minimizes brain drains, and it negates the physician attrition because of retirement. Your role and function as the new generation of physicians is cut out for you. I wish you well as you embark on your new medical frontier. I leave you with the words of one of America's leading basketball coaches, John Wooden. Do not let making a living prevent you from making a life. I congratulate you all.
Thank you very much, Dr. Roberts. We're happy to have the police pop band with us. So just to give you a little entertainment, we'll have a selection from them at this time.
Sugar, darling, there ain't nothing sweeter. You make me dream, you make me fall, you make me feel like I can fall. Sugar bum, 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 sugar bum. Hey. work with her. Darling, you put me in trouble. So you talk to me the way you whine. I love to see your woman whine. Sugar boom, sugar boom, sugar boom, sugar boom, boom. Sugar boom, sugar boom, sugar boom, sugar boom, boom. Audrey, I don't want to lose you. Darling, it's like you give me good. I did really hard, I did really far. But man, no man, touch me sugar. Sugar boom, sugar boom. Sugar boom, sugar boom, boom. Sugar boom, sugar boom. Sugar boom, sugar boom, boom. Sugar boom, sugar boom. Sugar boom, sugar boom, boom. Sugar boom, sugar boom. Sugar boom, sugar boom, boom. Say, give me that boom, boom, oh, oh. Give me that boom, boom, oh, oh. Say, give me that boom, boom, oh, oh. Give me that boom, boom, oh, oh.
Please, at this time, receive our Minister of Health and Wellness, the Honorable Dr. Michael Darville.
Thank you so much, Dr. Johnson. I know there's many brothers who are doctors, and thank you so much. Now, I'm fighting a little cold, so I'm going to bring the mic a little bit closer to me or probably take it down. Give it up for our graduates. You know, Prime Minister, in our meetings, we had multiple discussions about graduates from the University of the West Indies. And what was so interesting is, as we began to look at the numbers, Dr. Roberts, it seemed like the women are taking over the graduates from the University of the West Indies. We are seeing it, and we are going to be challenging our young man to try to catch up. But I want the man who graduated into the program to please stand up for me, because you're few in number, but I'm proud of you. Thank you so much. Standing on the set protocol, I would just like to take this opportunity to recognize our Prime Minister, the Honorable Philip Brave Davis, Dr. Robin Roberts, Dr. Glenn Benaby, colleagues, graduates, ladies and gentlemen, good afternoon. It is indeed an honor to be here today at the Bahamas Convention Center to bring congratulatory remarks to you, the most recent postgraduate residents of the University of the West Indies School of Clinical Medicine and Research. The reason why that's so important is 6 months, a year ago, we would not be able to be here today with the majority of us not even wearing a mask. Isn't God good? Prime Minister, it seems like yesterday we were both in hospital receiving quality care from well-trained doctors and nurses as a result of complication of COVID-19. I am thankful for their compassionate care that I received during my course of treatment, and I thank God for a second chance and for this wonderful opportunity to serve under the leadership of our Prime Minister.
friends and colleagues. In every age, there are events that define that period of time. Events that cause us to stop, to take stock, to hit the reset button, and to help us to focus on life in the broader sense. I believe that event in our age is the COVID-19 pandemic. None of us here today could have even predicted such a pandemic and would have foreseen the devastating impact this pandemic would have on our public healthcare system and the challenges it would have brought to our medical fraternity. In the past 2 years, medical and healthcare professionals worldwide have been in crisis mode, operating in overdrive, pushed to the limit, not only physically, but emotionally. We have lost colleagues on the front line. We have buried family members. We have seen friends, loved ones suffered from the complication of COVID-19. Thank God the fog of COVID-19 has started to lift over our loving Bahama land, and we at the Ministry of Health and Wellness can see clearly the need we currently face and begin to focus on essential healthcare upgrades, improvement in healthcare delivery systems, and the vital role healthcare professionals must play as we strive to rebuild and improve the medical services across the country. Today more than ever, there's a pressing need to ensure that our medical facilities have a cadre of well-trained doctors, specialists, nurses, and other healthcare professionals. I am very pleased to see the amount of graduates here today and the University of the West Indies continue to play an important role in helping us in the Commonwealth of the Bahamas to meet those needs through high-quality medical training. Colleagues, we need your services and recognize that you have been under intense pressure during this pandemic. But despite it all, your hard work and dedication to your studies have made this day possible, and I am convinced that those same characteristics are what will make you as a professional do extremely well in the country. So as we celebrate your accomplishments, along with your families, friends, mentors, and colleagues, I want you to know that you are an important team member in healthcare delivery throughout the country. It is an awesome responsibility, and as Minister of Health and Wellness, I stand with you and the wider group of medical professionals in ensuring that we do the best job we possibly can in delivering the best quality healthcare services for the Bahamian people. Finally, I would like to take this opportunity to commend the University of the West Indies School of Clinical Medicine and Research, and to thank Dr. Robin Roberts, the directors of the program, along with lecturers and staff at the University of the West Indies. We in government recognize all of the hard work that you have been doing in order for this program to be successful. We appreciate all that you have done, and we encourage you to continue to make a difference in medical training and to help us reform our healthcare system. To the graduates here this afternoon, congratulations on completing your postgraduate studies. Even though these graduation exercises were delayed to COVID-19 restrictions in 2020 and 2021, we are pleased that you are finally here to receive your great rewards. I implore you to remain enthusiastic, optimistic, despite the challenges in our healthcare system. Stay dedicated to your patients. The lives of our citizens is depending on you. I'm excited. I look forward to more graduates as we begin to make sure that you all do an intricate part in building our healthcare services. And as Minister of Health and Wellness, I want you to know that I am available to listen and to be a part of the direction you all will play in healthcare delivery. I congratulate you once again, and I would also like to say that Dr. Robin Roberts, who will be leaving the program, am I right or wrong, Dr. Robin Roberts, in July of this year? You got to give it up for him. We're going to miss you in the program, but we are sure that others will come and make their mark, and many of our new graduates will make their mark as well. And I'd also like to say that while you are up here speaking, there are many other postgraduates who are not a part of the UWI program, but are supported by the government of the Commonwealth of the Bahamas. And we congratulate them, and we look forward for them to joining the system as we all work together to do our part to take us from where we are into the 21st century in healthcare delivery. Thank you, and God bless you.
Thank you very much, Minister. Give him another round of applause, please. Indeed, we do thank Dr. Roberts for his labor of love and his dedication to the School of Clinical Medicine and Research. I don't know what he is going to do once he no longer has that to do, because Dr. Roberts has no idea how to keep still. So I'm sure he'll find something else to do. Please stand with me at this time and receive our Prime Minister, the Honorable Philip Davis.
Thank you very much, Dr. Johnson. Please be seated. Dr. Johnson, I just wanted to, I'm happy that you did not recognize me as a doctor. Prior to September 2021, I was often reminded, 2 years previous to that time, that I was not a doctor, and I am the doctor. Dr. Robin Roberts, on behalf of a grateful nation, I want to say thank you for your contribution to this worthy cause of training our doctors to provide services to our people. I include Dr. Benaby in that, and to all those who are here present in that regard. Just let me say good evening and congratulations to all the doctors in the house tonight. You have worked hard and you deserve to be celebrated for this monumental achievement. I'd like also to recognize the Bahamas campus of the University of the West Indies School of Medicine and Research for its remarkable contribution to the education and training of new doctors and the progression of healthcare in the Bahamas. Since 1997, as we were told, 572 doctors have been trained by our UWI campus. Remarkable. Even more remarkable is the fact that 80% of them are Bahamians. That includes over 127 specialists spanning 7 disciplines. That is certainly praiseworthy. Now we have another batch of doctors ready to make their mark on the world. I welcome you all with open arms. We can certainly use more medical professionals in this country. When my administration first took office, one of the first things we did, and I caused to happen, was a visit of various hospitals, and in addition, caused the Minister of Health and Wellness to visit clinics throughout the country to get a sense of just how much work we needed to do. This included conversations with our medical professionals who had spent the year prior taking on the worst healthcare challenge that the world had ever faced. It is no exaggeration to say that we would have fared much worse as a country during the global pandemic if not for the sacrifices of our medical professionals and frontline workers who risk their own health and well-being for the sake of others. Again, I would like to say thank you to them. We often talk about the glamour involved with being a doctor, but we should also remember the sacrifices necessary to save lives each and every day. It takes a toll, yet every day our doctors answer the call of duty, committed to doing their best, even when working in less than ideal circumstances. This is the noble profession that you are now entering. Today, you formally swear your oaths as doctors. It is a sacred oath as old as an ancient Greece itself. There's a level of trust and respect bestowed with the title of doctor that will follow you for the rest of your lives, even outside the context of your work. At some point, you may even find yourself at a public event, in a restaurant, or on the phone, on a plane, and someone call out, "Is there a doctor in the house?" You'll be able to answer that call, answer that call, and tonight, there are 39 of you, specialist doctors, who will take their oaths and participate in this, I understand, robing ceremony. There are 39 Bahamian-born and trained doctors in the house tonight. I'm so proud. They deserve a hand. With all these doctors in the house, I can't help but feel that this convention center is one of the safest places to be in Nassau right now. God forbid any medical situation should arise. There's certainly a well-trained doctor nearby to save the day. All the years of hard work, the long nights of studying, and the sweat and tears shed along the way have paid off. You should be so proud of yourselves. I'm certainly proud to see so many bright minds before me today. And I'm sure you're making your parents, your mentors, and family and friends proud as well. You know, I had a daughter who completed a medical school too. I was filled with much pride as a father. And I know, as I indicated earlier, the parents and loved ones who are here are also beaming with the pride at this accomplishment as I did then. Being a doctor is one of those dream professions, isn't it? If you ask a child what they want to be when they grow up, many of them will respond with that familiar answer: I want to be a doctor. I remember because when I was young, they asked what I wanted. I said, I wanted to be a doctor. That was the refrain in my day. So many have that dream growing up, but it's only a fortunate few who hold on to that dream and work towards that goal until it becomes a reality. You are now among that fortunate few. Congratulations once again. I look forward to witnessing the contributions you will make to local health care, as well as on the national and international scene. A pleasant good evening to each and every one of you. I want to thank you. And as you were reminded by Dr. Roberts, you'll be engrossed in your work, but also remember that there is life. And I was looking over there. I didn't see much life when I heard the music. Music usually inspires and inspire. And that is one way of demonstrating that you're living. I saw only with 3 legs being tapped, 2 shoulders shaking, and perhaps remember that admonition, that with all you do, remember, there's still life to live. I thank you. God bless you all. I wish you well in your future endeavors. Thank you.
Thank you very much, Prime Minister. You may be seated. When the family medicine program started in 2002, if I remember correctly, there were 4 persons enrolled in the initial program. They all successfully completed. One of those persons is now the coordinator of the postgraduate program. That person is Dr. Francis Williams. Dr. Williams will be coming to you right after the pop band has given us another selection, and he will be taking part in the recognition of the graduate ceremony. So once the pop band is completed, Dr. Francis Williams, our postgraduate coordinator, will come to take part in the ceremony. Pop band.
And the highest mountain, and deeper than the sea. That's how I will hold you. Say, darling, endlessly, softer and the gentle music, and stronger than a wild oak tree. That's how I will love you. Say, darling, endlessly. Oh, darling, and girl, you're my crown. Oh, you're all I pray for. You're made for these arms to surround. Oh, faithful as the morning sunrise, and sacred as a love can be. That's how I will love you. Say, darling, endlessly. Oh, darling, endlessly. Come on, darling.
Good evening. Honorable Prime Minister, Minister of Health, distinguished guests, graduates, friends and family, good evening. At this moment, we will be giving the graduates their awards and we'll be recognizing them. How it will be done, we will go by each specialty first, and that will be followed by a person who has been selected to bring remarks on that specialty. We will start with surgery. Surgery has one graduate, Dr. Lucas. However, Dr. Lucas is presently doing a fellowship and he is unable to be here. So I would like to now invite Dr. Fantario Taylor, a former graduate of surgery, to bring remarks for surgery. Please welcome Dr. Taylor.
Good evening, all. Protocol being established, I'd like to thank the university for asking me to speak tonight on behalf of surgery. The DM program is one in which we are full-time physicians and full-time students. However, it is well-staffed with full-time lecturers and mentors who are there to help us navigate the syllabus and life as a resident. Specifically, Dr. Monroe, who stressed the value of surgical principles and proper history taking. Dr. Shea, who taught me the importance of punctuality and time management. Dr. Francis, who was also always willing to give constructive criticism. Dr. Farquharson and T. Ferguson, who taught me endoscopy. Dr. Srikanth and Fitzcharles, who showed me the importance of the appearance of the finished product. And Dr. Sands, who challenged me to read and support every stance that I took. So even though the hours were long and the work challenging, we had excellent guidance. Additionally, as Dr. Roberts would always say, there's no lack of pathology to operate on in PMH. So we were exposed to almost all of the syllabus in the operating room and in the clinics. As a young resident, I was encouraged when I saw Dr. Alfred Dawes come through and do well. Then Dr. Major and Dr. Humes before me. I was able to do the same, and Dr. Lucas after me. As you will hear repeatedly, if you can make it here at UE, you can excel anywhere in the world. UE graduates make a good impression, and wherever they go, they pave the way for others. Dr. Major immediately before me, and Dr. Francis in the not too distant past, made a good impression on the folks at the University of Calgary, which meant I was able to secure a fellowship in transplant surgery before I'd even finished my DM surgery exam. So this time, around that a few years ago, I was in Canada training as Dr. Lucas is now. On behalf of the most recent DM surgery graduates, I'd like to thank the university for world-class education and congratulate the remainder of the class on a job well done. Thank you.
Thank you, Dr. Taylor. And we would certainly like to recognize Dr. Wesley Francis, who is the coordinator of the surgical program. So I would like to invite Dr. Eugenia Comby, who is the coordinator for the psychiatry program, to present the award to Dr. Daniel Lloyd, the only graduate tonight from psychiatry. Thank you. Dr. Lloyd will now bring remarks on behalf of psychiatry.
Protocol already established. Good evening, everyone. My name is Dr. Lloyd, and I am grateful for this opportunity to talk for a few minutes. According to the World Health Organization, mental health is a state of well-being in which individuals realize their abilities, cope with their daily stresses of life, and work productively. Over the past few years, the Bahamas faced challenges that put many Bahamians' mental health at risk. In September of 2019, Dorian, a Category 5 hurricane, battered parts of the Bahamas Islands, specifically Abaco and Grand Bahama. This caused significant damage to these two islands. As a part of the mental health team sent to offer psychiatric first aid, I was allowed to experience some of the horrific stories that happened to a lot of these individuals. They would recall their horrific life-threatening situations where there were loss of homes, cars, personal belongings, and unfortunately, loved ones. The atmosphere was full of despair, and many were shocked, could not sleep properly. They had recurrent nightmares, and many had developed acute stress disorders that eventually went on to post-traumatic stress disorder. A few months later, the world faced the COVID-19 pandemic, which had led to significant increase in stress for Bahamians. Quarantine and restrictions caused social isolation and completely changed our daily routines. The pandemic affected people differently. Some worried about their health, whether they would catch this virus and die from it. Others were more concerned about not being able to work and provide for their family. There was a significant increase in the number of persons diagnosed with anxiety, depressive disorders, suicidal ideations, substance use disorder, and panic attacks. Currently, the Bahamas has about 14 Bahamians registered under the Medical Council in the Bahamas. These individuals help to tackle the issues that nearly 400,000 Bahamians face, psychiatric issues that the 400,000 Bahamians face. By my calculation, I estimate that there is a deficit of about 26 psychiatrists compared to the 14 that we have right now. We should have maybe about say 40 for the 400,000 individuals in the Bahamas. I am the first graduate from the psychiatry program in the last 8 years. And thank you. And I would like the psychiatry program provides the opportunity for candidates to obtain high quality training in psychiatry, providing the tools for the transformation of the landscape for treating mental issues in the Bahamas. This transformation includes increase in local research on mental illnesses, a decrease in the psychiatric morbidity and mortality, and removal of stigma associated with mental illness. And also, we must look at revising some of our outdated mental health laws. I am proud to say that we currently have 10 candidates enrolled in the psychiatry program at UWI, with 5 of them expected to graduate this year. This is great news as the demand for trained mental health professionals is expected to increase in years to come. Some may argue that the University of the West Indies psychiatry program is perhaps the best in the Caribbean. Others may say it's the best in the world. And it's for this reason I would like to encourage more physicians graduating in MBBS and those who are interested in medicine on whole to consider psychiatry as a specialty. Thank you so much and have a good night.
Thank you, Dr. Daniel Lloyd. So we're going to move into presenting the awards for internal medicine. And I would like to invite Dr. Dion Dames, the coordinator of internal medicine program, to come up and do the presentations. From internal medicine, we have Dr. Leanne Bartholomew, please. Dr. Ricardo Davis. Dr. Jason Thompson. Dr. Deanna Bannister. Dr. Nicholas Deal LaRota. And finally, Dr. Nevelina Munnings. Thank you. I'd like to now invite Dr. Ricardo Davis to bring remarks on behalf of internal medicine.
Good evening. Protocol having been established, I'd still like to thank the Honorable Prime Minister and Honorable Minister of Health for attending this event. I appreciate it. It is with humility I speak on behalf of my fellow graduates on the importance of the internal medicine program. Internal medicine is considered the backbone of many health hospital-based systems as one of the most vast areas of medicine with multiple subspecialty disciplines. It is constantly evolving as new research emerges involving new conditions, diagnostic criteria, guidelines and algorithms, management techniques, and medications. Needless to say, the study of internal medicine is also understandably difficult to navigate, as I'm sure my fellow graduates can attest. Trust me, we've had many long, stress-filled, sleepless nights. For years now, the University of the West Indies Bahamas Internal Medicine Program has been important to the training of internal medicine specialists locally, providing a vital opportunity for physicians to continue their medical training in a world-renowned school, and for Bahamians, the opportunity to do so in a familiar environment, particularly for those who may not be able to leave home for various reasons. On a larger scale, it provides the country with the opportunity to expand the pool of knowledge and expertise in various areas of the medical field to the benefit of local health systems. In particular, this COVID pandemic has caused our Department of Internal Medicine to be particularly stretched and shown the importance of internal medicine specialists in this country. Undeniably, this program is difficult. It does test you. It tests your wit, organization, your temperament, your sanity, and your commitment to continue. For many of us, it has not been an easy road to travel, and at times you question if it's all even necessary. But having reached the end of that road, we find the meaning in the struggle. We have become stronger, more organized, resilient, better communicators, and of course, a bit wiser along the way. Indeed, graduates of the UEDM programs have been able to thrive in any medical environment worldwide. In recognition of this, and I know this is not a vote of thanks, but we would like to thank the school and all those who helped us to arrive at this point, including our heads of department, Dr. Hunt Burrows, and previously Dr. Curling, and in particular our program directors, Dr. Dames Raming, and previously Dr. Sawyer, who guided, supported, and championed us along the way. Gratitude and thanks are also extended to our support systems, both family and friends who encouraged and uplifted us when times got rough. We thank the university for providing the opportunity to celebrate our achievements, and we hope that others continue to find success in this program and look forward to celebrating with them on their day as well. Thank you very much.
Thank you, Dr. Ricardo Davis. And we'll now move to the specialty that started it all. We'd like to invite Dr. Sabrika Pinder Butler, coordinator of the program, to present awards. Vashti Darling. Janice Edwards Rollins. Dawn Gallagher is unable to be here this evening, but we recognize her nonetheless. Maitesha Norwich. Rhonda Roberts Carter. Samra Zonacle Newton. Sanita Belgrave. Okay, who is unable to be here this evening? Trumiko Boleg. It isn't frequent that we have a husband and wife couple in the program graduating at the same time, but we do, and I invite Dr. Danielle Strawn Boleg. Dr. Shanique McCarty is unable to be here this evening. Michelle McLean Morgan, also unable to be here this evening. Karis Thompson Major. Dr. Thompson Major is the sister of Dr. Thompson from internal medicine. So, Jason Thompson. Kia King Strawn sent her apologies, and she is unable to be here this evening. Dr. Tina Bethel Mims. Dr. Dana Ray Watson Providence. Dr. Ingrid Bonamy. And finally, Dr. Rodlin Malcolm. Thank you. I'd like to now invite Dr. Vashti Darling to bring remarks on behalf of family medicine.
The wise man builds his house upon the rock. In medicine, that rock is primary health care. The Right Honorable Philip Davis, Prime Minister of the Commonwealth of the Bahamas, the Honorable Dr. Michael Dorrell, Minister of Health and Wellness, Dr. Robin Roberts, Director of UWI SCMR, Dr. Francis Williams, Program Coordinator, DM graduates, ladies and gentlemen, a pleasant good evening. One may ask, what makes you special? Aren't you just a general doctor? The answer to that question, training. Family medicine specialists undertake a rigorous 4-year specialty program, which affords us the opportunity to treat most ailments and provides health care for people of all ages, from newborns to seniors. We literally take care of the entire family. The prestigious family medicine program was founded 20 years ago under the vision and leadership of Dr. Sherilyn Hannah Mahace. Recognized as being the first postgraduate program established at the UWI Bahamas campus, we continue to make strides in postgraduate education, having had a total of 55 successful graduates to date. We have all heard the old adage, an ounce of prevention is better than a pound of cure. When it comes to healthcare, this couldn't be more applicable. As a family medicine specialist, my role is to develop and sustain a trusting relationship with my patients, such that they look forward to coming to see me, not only when they are unwell, but when they are well, in an effort to keep them healthy. At the level of the community, we get to see firsthand the social determinants of health and are able to thereby act as a liaison between the patient and the government on their behalf. We are more often than not the patient's first contact for health concerns and play an important role in early identification of diseases and are able to navigate the healthcare system with the patient as it relates to specialist care and follow-up. On a larger scale, at the level of the government, a strong primary care division reduces healthcare costs, increases healthcare quality, and provides access to healthcare across the country. I can say this realization was brought to life with the implementation of the National Health Insurance Authority in 2017, which puts family medicine at the forefront where we ought to be. I implore you, attach yourself to a family medicine specialist. Get your annual health visits and allow us to take care of you and your entire family. Thank you.
And so we will move on to emergency medicine, who has made a special request, which we are happy to accommodate. So I'd like to recognize first the coordinator of the emergency medicine program, Dr. Krista Wells, and she will be accompanied by Dr. Pavia Davis and Dr. Raquel Davis, who are consultants in the department and associate lecturers. Dr. Pavia Davis would have mentored Dr. Shimon Ferguson Charlton, and so we invite Dr. Charlton to come up. Dr. Sergey Kerr. Thank you. I'd like to now invite Dr. Raquel Davis to do the next presentation. Dr. Kyle Kerr. And Dr. Madeline Joseph will be presented by Dr. Crystal Wells. Thank you. And so I will now invite Dr. Shimon Ferguson Charlton to bring remarks on behalf of emergency medicine.
Good evening, everyone. Protocol having been established, it is an absolute honor and a pleasure to stand before you this evening as a graduate, to share with you the impact of emergency medicine residency program on the specialty of emergency medicine and its future development here in the Bahamas, on behalf of my fellow emergency medicine graduates. Please close your eyes for a moment and imagine a frantic parent rushing their child into the emergency room, unresponsive. The child had taken a toxic amount of an unknown substance. Her breathing is shallow and her blood pressure is low. It is so low that her heart is in jeopardy of stopping if left untreated any longer. Imagine them arriving at the hospital and there are no trained emergency medicine physicians there to intervene immediately. You can imagine the outcome. Now open your eyes. That is where we come in. Within minutes, we have simultaneously assessed the child's airway, breathing, and circulation, and we have intervened appropriately. And in 10 minutes, her vitals have stabilized, and we can help to calm the fears of the frantic parent. This is just one of the many life and death situations we encounter daily in the emergency department. And even though the specialty is still somewhat in its adolescent to pubertal years, the specialty plays a vital, pivotal role in our healthcare system. The specialty of emergency medicine has finally been placed and recognized on the map of medicine, not only globally, but locally as well. I believe emergency medicine is at the center of the kaleidoscope of medicine, where it encompasses pre-hospital as well as in-hospital acute care medicine, making it the first point of contact for many patients, especially in times of crisis. It is a specialty that equips its trained physicians with the knowledge and a particular subset of skills required to care for patients with emergent and even urgent healthcare needs. Our emergency medicine residency program, home-based out of Jamaica, has done just that. Our program officially started in 2008 with 4 female residents: Dr. Crystal Wells, who is currently our head of department, Dr. Pavia Davis McKinsey, and Dr. Raquel Davis Hall. And we cannot forget Dr. Cordelia Nairn. May she continue to rest in peace. These physicians pioneered the way forward in the program and were known as the Golden Girls of emergency medicine. Since then, the program has birthed 8 additional emergency medicine specialists, of which my fellow graduates and I are a part. This program provides our nation's healthcare system with trained individuals who are able to manage a wide range of conditions, and we are able to make split-second decisions that can save a patient's life. This program allows for the specialty to continue to grow and has allowed for longevity of the specialty. Studies have shown globally that the patient visits in the emergency department have grown immensely over the years, and we are no different here in the Bahamas. The way forward is to see this specialty continue to expand, allowing for the ED to continuously have presence of trained emergency medicine specialists and to have trained specialists at satellite urgent care units at outlying community clinics to better serve the population of our nation. My colleagues and I are committed to saving lives. We are committed to navigating patients through their near-death experiences to stabilization. Amidst a continuing global pandemic, workplace injuries, vehicular accidents, community violence, and self-inflicted wounds, we are committed to doing our best to ensure another sunrise. We have sacrificed over the past few years because we want to be a difference and make a difference. Emergency medicine residency program plays a very critical role in making this happen. It helps us to intervene in moments when life can seem so unsure and time is a limited resource. That is why we have spent countless hours and years studying and practicing, because we want to heal. We want to help. We know that we cannot do it alone. God is the great physician, and we are his humble servants. We look to him for wisdom and guidance because we also need the support of our nation, our peers, and our residency program to continue to serve the great people of our great Commonwealth. Congratulations to my fellow graduates and their families on this great achievement. Thank you and God bless.
Okay, and so we've now reached pediatrics. Dr. Gwen McDigan, who is the coordinator of the program, sends her apologies. So we'll ask Dr. Corinne Sincree Brown to do the presentation on behalf of pediatrics. Dr. Shevet Stevens. Dr. Sharonique Miller. Dr. Lakeisha Brown. Dr. Samantha Cartwright. And finally, Dr. Davianne Cartwright. So I'd like to now invite Dr. Deshaun Ferguson Sanders, Deputy Medical Chief of Staff at PMH and pediatrician, to bring remarks on behalf of pediatrics.
Protocol being established, good evening. As the first Bahamian to graduate from the Doctor of Medicine in Pediatric program approximately 10 years ago, and presently a pediatric consultant, director of a general medical team on the children's ward, and deputy medical chief of staff, it is possible. I am proud to give a response on behalf of our pediatric postgraduates, past and present. Since 2007, we have a total of 18 graduates that have passed through our program. Sad to say, however, 2 of these young, vibrant, with so much promise, pediatricians have passed away. May we just take a few seconds of silence as we remember them. Dr. Derek Gregoire, and Dr. Ainthe Cartwright Bastian, who passed during the COVID pandemic. May they rest in peace. Our pediatricians not only practice here in the Bahamas, but also in other islands, including the Cayman Islands. Our pediatricians work both privately and in the public sector. This speaks volumes to our program. Like a domino, it takes just one to start the domino effect, and others fall behind. We hope that our doctors will continue to be inspired as they allow others to follow in their footsteps. We take great pride as pediatricians as we care for the children of the Bahamas. My hopes is that our pediatric program continues to grow as we continue to meet the growing demands because babies are born every day. To my fellow pediatricians who are coming behind me, I say to you, congratulations, and may you continue to grow and strengthen the Department of Pediatrics. Congratulations, and thank you.
And so we've now reached the final specialty of obstetrics and gynecology. And so I'm going to invite Dr. Riley Butler up to present the awards. Dr. Riley Butler is the coordinator of the obstetrics and gynecology program. Dr. Rodian Wallace is not in the Bahamas at the moment, but he is a graduate of the program. Dr. Ejuma is, please welcome Dr. Ejuma. Nanika Ejuma. Dr. Nakisha Hall Dennis. Dr. Hall Dennis is the daughter of noted obstetrician and gynecologist Dr. Hall Watson. Dr. Janelle Osadabe is unfortunately not here. Thank you. And so that brings us to the end of the awards presentation. I will ask Dr. James Johnson to introduce our speaker, Dr. Darren Holliday.
Please give Dr. Williams a hand. Thank you very much, Dr. Williams. In 2003 was when we initially started the obstetrics and gynecology program. But Dr. Halliday started in 2004, and he was one of 3 persons who started the obstetrics and gynecology program here. At that time, I served as the coordinator for the obstetrics and gynecology program. Dr. Halliday, having completed his DM program here, then went to Canada to subspecialize in gynecological oncology. And since then, he has been here with us, along with Dr. Butler, providing services in this area. Dr. Halliday, though not having had the good fortune of being born in the Bahamas, he was born in St. Kitts. However, he had the good sense to understand that the Bahamas is where he wants to be. And so, therefore, he is here. And we are very thankful that he has remained with us. Dr. Halliday is the kind of graduate that makes me extremely proud. In fact, having served as the first coordinator, Dr. Halliday is here as a gynecological oncologist. Dr. Richard Braham is now the head of the Department of Obstetrics and Gynecology, and Dr. Lucio Pedro, who is actually from Botswana by way of Guyana. He's a naturalized Guyanese now. He's now the head of the department in Guyana. So it makes me very proud to know that the initial three persons are contributing greatly, either here in the country or in the region. And so at this time, we're going to have Dr. Halliday come and bring a short address for us. Dr. Dr. Darren Halliday, give him a round of applause as he comes, please. Any orthopedic surgeons?
Good evening, ladies and gentlemen. I would like to adopt the protocols that has already been established. I would like to thank the members of the organizing committee for this prestigious honor and opportunity to give this address. Isaac Newton used a popular expression in a 1675 letter. It says, "If I see further, it's by standing on the shoulders of giants." Standing on the shoulders of giants is a metaphor which conveys the idea that all current intellectual progress is gained from major thinkers who have gone before. The illustration is often used that if a dwarf and a giant are in the forest, the dwarf by himself cannot see, and the giant may see to some extent, but the dwarf will see further on the shoulder of the giant. When we consider all the turmoil in the world today, the war in Ukraine in particular, we realize that we are blessed. And this merry moment that we enjoy are the result of the sacrifices of the generations who have gone before us. Our families, the communities at large, our teachers, our mentors. We give thanks to God and pray for all those who are in distress at this time. Stability in our society has allowed us to pursue knowledge and excellence. Each generation must build on the legacy of the previous one. The sacrifices of your parents and the community at large cannot be taken for granted. For many of us, our parents and our relatives worked day and night, saved and took loans to ensure that we are able to complete our studies without distress. It is the stability of the government in our region that progressive developments of our communities can occur so that we can pursue education. And we see that in Afghanistan, they are closing schools for women. And we see that most of our emergency physician medicine specialists are women. Many of our governments had made an effort to provide primary and secondary education at no cost. And in many regions, school lunch is free. Tertiary education is a result of scholarships and government assistance. However, as the saying goes, there's no free lunch. Somebody has to pay. The society has borne the cost of our education. Our teachers have devoted their entire lives preparing lessons and marking scripts. I have no doubt that some of us have natural talents, sheer determination, and hard work and discipline played a part in your success. But as Bob Proctor puts it, a mentor is someone who sees more talent and ability within you than you yourself can see and help brings it out of you. And this was my experience as I was pushed to pursue a fellowship in gynecologic oncology. Martin Luther King Jr. said, "So I say to you, seek God and discover Him and make Him a power in your life. Without Him, all of our efforts turn to ash and our sun rises into darkest night. Without God as a spiritual and moral compass, we can easily become cold and callous. We need Him to comfort and strengthen us in this high stress environment. And in my field, many of our patients do not make it. We need Him to keep us focused on the goal without being discouraged, as we ourselves are called to cure sometimes, to relief often, and to comfort always, in the words of Edward Trudeau. We need God's love within us so that we can truly be compassionate towards our patients and to deal graciously with each other. Now, having reached this pinnacle, what do you see and how are you now able to see it? I believe it's because you stand on the shoulders of giants. Walking down the photo gallery at the Princess Margaret Hospitals caused me to reflect of the many talented Bahamians. We collectively think of our senior colleagues who have left an indelible legacy, such as Dr. Roberts, Dr. Sands, Dr. Monroe, Dr. Gibson, the late Dr. Lunn, Dr. Benaby, Dr. McNeil, Dr. Gomez, Dr. Sawyer, Dr. Butler, Sinqui, Sherman, Brown, Dr. Nottage, and the list goes on. Many others, as has been highlighted, over 80% stay in the Bahamas because they have the idea that they want to build something better and benefit the Bahamian people. Leaders in research, hypertension, HIV, excellence in ethics, that's Glenn Benaby, open heart surgery, renal care, dialysis, kidney transplant, women's care, child care, critical care, orthopedics, spinal surgery, cancer care. Medical education in the Bahamas has seen significant developments as the result of dedicated individuals. To make this sustainable, they pushed to establish the medical faculty of the University of the West Indies at home to bring opportunities to the next generation who have become doctors and specialists, but also have given us the opportunity to subspecialize here as well. I don't know if you know, but under the leadership of Dr. Butler, we've started a Gynae Onc fellowship here in the Bahamas under the leadership of Dr. Butler, together with the International Gynae Cancer Society. We are the products of that vision, endeavor, and patriotism. We are most grateful. I go off script here. Even though I was not born in the Bahamas, I had many Bahamian friends, and it does feel like home. And our family is a true UWI family. Both of my parents were educators and attended the University of the West Indies. I am one of 5 siblings who attended the University of the West Indies, and my sister enrolled her daughter, who is in the Faculty of Medicine at the University of the West Indies. The University of the West Indies has inspired confidence in us. It is one such giant in our region on which we can all stand, and is the pillar of the healthcare system in the Bahamas. UWI, a light rising from the west. All these great men and women in the Bahamas, their remarks were all similar. We came back to build. We knew there was little. In some cases, we use our own funds to buy equipment so that we can serve our people. We put the time in the institution. We did the research. We tried to convince the government. We provided them with the evidence and asked them to implement certain changes so that suffering among this great people could be alleviated. When resources were limited, partnerships were established with the government and international institutions to build relationships and bring the services here. I could remember Dr. Gibson talking many years ago about the rotating group of spinal surgeons who would come and provide scoliosis surgery to the Bahamian people. There, these great mentors remarked, we made it happen. We had to make it happen. We had to help our brothers, our sisters, our family. As the saying goes, we mix up like conch salad and we one family. The question to the graduates now is, how would you give back? Seeing that you have such a great vantage point. There's still lots of research to be done. The sentiments expressed during the Medical Association of Bahamas conference concluded this evening was that there is a lot of talent in the Bahamas among the medical community. Let us come together and build on the solid foundation that is here. Our generation now has to do our part. There will be periods of rebuilding and restructuring. Let us do the collaborative research cost analysis and develop the human resources needed and invest in sustainable technologies. Learn the history. Dr. Harold Munnings has written a whole book on the Princess Margaret Hospital. How many of us have read it? Okay. So, understand the history. Understand the struggles. Build on the gains of the past. Remember the examples and the sacrifices of those who have gone before. I end with the words, these solemn words of the national anthem of the Bahamas. Pledge to excel through love and unity. Pressing onward, march together to a common, loftier goal. Thank you very much.
Thank you, Dr. Darren Halliday. And so we are now winding down, and it is my duty to thank a few persons. But before I do, I just wish to say that this evening has indeed been a special occasion, and one that would have never been possible at this time in this place without God's doing. It has been a ceremony delayed but not denied. And God has orchestrated it in such a way that 20 years after starting the UWI program in the Bahamas, we are able to singularly recognize you, the graduates, and celebrate you this evening. I would like to thank the Reverend Dr. Glenn Benaby for setting the tone with his sage words of prayer. The Reverend Dr. James Johnson, when asked to be Master of Ceremonies, did so without hesitation. And as we have come to expect from him from other ceremonies, he has been masterful in his presiding. Thank you. I'd like to thank Dr. Robin Roberts, the director, for his leadership. And I believe, knowing at this stage, we should give him a round of applause and a standing ovation. Thank you, Dr. Roberts, for the work that you've done through the years, and certainly for the overview that you provided this evening. It is not common that we have both the Minister of Health and now additionally Wellness and the Prime Minister at such events. So we are indeed grateful. The Honorable Dr. Michael Darville spoke about the country needs and how it needs the service of you, the graduates. That it is important to know that you are a part of a team, to remain enthusiastic and optimistic. And most importantly, as Minister of Health, he has our ears. Thank you, Mr. Minister. The Honorable Philip Davis, Prime Minister, spoke about how he looks forward to your contributions, both locally and internationally. And so we all do. We certainly thank you for honoring us with your presence this evening, and we appreciate your comments, Mr. Prime Minister. I would like to thank all of the graduates, some more recent than others, who brought remarks on behalf of their specialties. Dr. Vantario Taylor for surgery, Dr. Daniel Lloyd for psychiatry, Dr. Ricardo Davis for internal medicine, Dr. Vashti Darling for family medicine, Dr. Shimon Ferguson Charlton for emergency medicine, and Dr. Deshaun Ferguson Saunders, Deputy Medical Chief of Staff for pediatrics. Dr. Darren Halliday. Many of us consider Dr. Darren Halliday to be the quintessential physician, and so we were happy that you brought remarks accordingly. The Royal Bahamas Police Force Band has again outdone themselves. Thank you for the beautiful rendition of the national anthem and the other musical selections. Ms. Tanya Kelly and Ms. Marsha Bain, often behind the scenes, but were key in organization of the ceremony. Thank you. Would like to thank the media houses for being here this evening and those responsible for the live streaming and the recording of the ceremony. Thank you. Certainly without the lecturers and those involved in the teaching and learning, we would not have the success stories that we see here this evening. We would like to thank all of the coordinators and their support team, the lecturers, for your investment in the students. Thank you. And the true reason, the success stories themselves, is the real reason why we're here this evening. We thank you, the graduates, who put many years of your lives in the hands of the School of Clinical Medicine and Research and have allowed us to share in your postgraduate training. Thank you. Finally, we'd like to thank all of you who have come out this evening to support the graduates and are here because of the love and support that you would have given them throughout the years. We thank you. Thank you all for being here this evening. Good evening, and Dr. Johnson will bring directions as to what happens next. Good night.
Thank you, thank you. Please give Dr. Francis Williams another round of applause. And now I have some instructions for you. The photographers need to take some pictures, and so they're going to give directions to you as well as you as to where they want you. And in the meantime, the rest of us are going to enjoy the pop band while the pictures are being taken. Police pop band. Photographers take over.